Good morning, everyone. It is a great honor to be here. Today, I'm going to talk about the CD7 CAR T therapy for treating mixed phenotype acute leukemia. I have nothing to disclose. As we all know, mixed phenotype acute leukemia is a rare but very aggressive malignancy characterized by co-expression of TB lymphoid and all myeloid marker on blast cells. Patients with refractory relapse disease often face a very dismal prognosis and have a very limited therapeutic option. So here we report the safety and efficacy of CD7 CAR T therapy for treating this group of patients. So the CD7 CAR T we use for this clinical trial is we called a naturally selected anti-CD7 CAR, NS7 CAR. Basically, CAR is manufactured without gene editing or additional gene transfer. So detailed manufacture process already previously published in the Blood. So I'm not going to repeat here. So we enrolled 20 MPAL patients. Subgroup are all listed here. More than half of patients belong to biphenotypic subtype with one clone expressing both T and myeloid marker. The other 5 patients belong to bilineage subtype with 2 clones either express T or myeloid marker. So the median age was 26, and from 8 to all the way to 58 years old. Median prior line of therapy was near 5 up to 13. At the time of enrollment, you can see the median bone marrow blast was 12%, up to 74%, and 40% of those patients with blast count more than 20%. So after the bridging therapy, and right before the CAR T infusion, we still have a 20% patient with blast count more than 20%, and some of those as high as 88%. 40% of our patients with extramedullary disease, and the other 30% of patients relapsed from previous allotransplantation, including one patient even had 2 prior allotransplantations. So to manage rapid progression disease, all our patients receive bridging therapy, and everybody received standard dose of lymphodepletion condition regimen, FC, and everybody only receive 1 dose of a CAR T. And we have 100% manufacturer success rate, either from patient, which accounts for the majority, or from their prior transplant donor. So here come with our important clinical outcome. You can see the initial response post-CAR T on day 30. 18 out of those 20, which means 90% of a patient achieved MRD negative CR. 8 patients with extramedullary disease, 5 out of 8 achieved the CR. Overall, 15 out of those 20 patients achieved the CR both in bone marrow and in EMD. The median follow-up time was 248 days. You can see all the way near to 5 years. For 3 years OS and leukemia-free survival for entire those 20 patients were 52.6 and 36.4 respectively. So breaking down in more detail, you can see for the 15 CR patients, 12 of those 15 subsequently received consolidation allotransplantation, including 3 patients had a second transplant. For this group of patients, the 3-year OS and the leukemia-free survival were 64% and 55% respectively. So really very great. So remaining 3 patients without transplant, 1 still remained leukemia-free till last follow-up on 194 days, and 2 died subsequently from GVHD and relapse within 3 months. For the other 5 patients less than CR, 1 died from progression disease, the other 4 received salvage allotransplantation. For the safety, you can see 85% of those patients only have a grade 1 CRS, and we do not have any neurotoxicity. 2 out of those 6 patients with prior transplantation history developed GVHD. So in vivo proliferation, the median peak, actually by flow cytometry analysis, was 82% occurring approximately 2 weeks. Similar data achieved if you do analysis by qPCR. So conclusion. This study demonstrated NS7 CAR are a promising therapeutic option for CD7 positive mixed phenotype acute leukemia, including patients who relapsed from previous transplant. Consolidative allotransplantation further improves survival outcomes in this aggressive disease. Certainly further study with longer follow-up and a large cohort are necessary to confirm the results. The CAR T cell were prepared by Hebei Senlang Biotechnology Company, and the clinical trial conducted in Ludaopei Hospital in China. And thank you very much for your attention.